Hi, I'm Javier Jimenez. I'm going to talk about canagliflozin and renal outcomes in type 2 diabetes and nephropathy. Definition. Canagliflozin belongs to a group of new oral antidiabetic that exerts their action by inhibiting the sodium glucose co-transporters type 2. It is used alone or in combination with another hypoglycemic agent.
So the last one we looked at today was canagliflozin for the treatment of type 2 diabetes. This is a completely novel drug that causes glucoseuria, causes glucose in the urine to be excreted, so that patients excrete calories basically in their urine, and this is the mechanism of action. It's unlike any prior therapy for type 2 diabetes. The biggest difference here is its effect on weight, because calories literally come out in the urine. So some of the calories that patients ingest don't even end up contributing to their weight, but come out in the urine. It causes the most weight loss of any of the drugs available for type 2 diabetes. And this is the big difference really compared with existing treatments. It is safe in the short-term studies that allowed it to be approved by the FDA. It does not cause hypoglycemia in monotherapy. It causes about the same degree of A1C reduction as other treatments for type 2 diabetes, but causes significantly more weight loss. In fact, some of the other drugs actually cause weight gain when they're taken for diabetes. There's two safety issues. The side effect is kind of an unusual one because glucose appears in the urine. There's an increased risk of fungal infections, fungal balanitis for men, and vaginal candidiasis for women, and probably simply relates to the milieu of the extra sugar in the urine being sort of a petri dish for candida infections to develop. Those are generally, not serious and treatable. The one long-term issue which hasn't been completely addressed yet is whether it might be related to increased risk for certain types of cancers. So the FDA has required post-marketing surveillance for this drug to see if in fact that is the case. They did not think that was likely enough that it was a barrier to approving the drug.
Application in medicine. In this double-blind randomized trial, we assessed patients with type 2 diabetics and albuminuria chronic kidney disease to receive canagliflozin at a dose of 100 milligrams daily or placebo. All the patients had an estimated glomerular filtration rate and albuminuria, and were treated with renin angiotensin system blockage.
Health Matters is an informational webcast brought to you by NetMeds, designed to keep you informed and up to date on popular medicines, emerging therapies, and even cutting-edge strategies for enhanced wellness, less sickness, and greater energy. This medicine contains canagliflozin, which works together to control blood sugar levels in adult patients with a form of diabetes called type 2 diabetes mellitus. It helps to lower the amount of sugar made by your body. It can be used alone or in combination with certain other medicines that lower the blood sugar level. Talk to your doctor before taking this medicine. If you have type 1 diabetes or ketone bodies in urine, or if you have kidney, liver, heart problems, and stroke. Consult your doctor if you are pregnant or planning to be pregnant or are breastfeeding before taking this medicine.
Pros and cons. Pros: the trial was stopped early after a planned interim analysis on the recommendation of the data and safety monitoring commit. Cause this mechanism is different than previous long-term treatment of type 2 diabetes mellitus.
The Credence trial was a trial that was designed to study Canagliflozin, which is a drug that people with diabetes take to lower the blood sugar. And we wanted to evaluate if Canagliflozin improved kidney function in people who have type 2 diabetes and have kidney disease with it. Credence showed that Canagliflozin reduced the progression to kidney failure by 30% compared to placebo. Importantly, it also reduced cardiac death and hospitalizations for heart failure by 31%. This finding is really, really important because it is the first drug in 20 years that shows that you can improve kidney outcomes and the progression to renal failure or kidney failure and hemodialysis in people with type 2 diabetes.
Issue applied in Ecuador. In the province of Rios, the incidence is higher, but still does not reveal figures because the study does not to end. Esmeraldas will be the next province in which area, with its work teams will focus its research.
This trial is really important because diabetes and diabetic kidney disease are 21st century epidemics. There are more than 400 million people with diabetes around the world at the moment, and 40% of these people will get kidney disease. Once they've got kidney disease, they're at very high risk of kidney failure, of heart attack, of stroke, of heart failure, and of death. People with diabetes who develop kidney disease have, at the moment, few treatments proven to be beneficial. In terms of preventing kidney failure, only one class of blood pressure lowering agents has been proven to be beneficial, and that was confirmed some 18 years ago. In the time in between, we've had no new treatments for this vastly important problem. So with this trial, we took a drug that's available today for lowering blood sugar levels in people with diabetes, but which we thought may well have additional special beneficial effects for the kidney. And we gave it to people with diabetes who already had evidence of kidney damage, mostly through the presence of protein in the urine. We took 4,401 of these people from over 30 countries around the world, and we gave half of them this drug, Canagliflozin, and the other half an identical placebo. And we followed these people for an average of 2.5 years to see what happened to them. We found a very dramatic result. We found that people who received this treatment had a 30% lower risk of kidney failure and related events. They also had a lower risk of cardiovascular events like heart attack, stroke, or death from cardiovascular causes, and a dramatically lower risk of heart failure. All really big problems in people with diabetes and kidney disease.
Conclusion: in patients with type 2 diabetes and kidney disease, the risk of kidney failure and cardiovascular events was lower in the Canagliflozin group than in the placebo group at a median follow-up of 2.62 years.
Type 2 diabetes can lead to a number of complications, including kidney disease. Healthy kidneys play an important role, removing waste products from the blood. Inside the kidneys, millions of tiny blood vessels act as filters. Many substances are too big to pass through the filters, so remain in the bloodstream, while smaller substances, including some waste products, flow through the filters and become part of the urine. Kidney function helps to regulate the amount of fluids and salts in the body and control blood pressure. But with type 2 diabetes, The high levels of sugar circulating in the blood can damage the kidneys and compromise their function. Approximately 40% of patients with type 2 diabetes have established kidney disease. Patients begin to lose their kidney function, including their ability to filter out waste, medicines, and excess fluids from the body. The presence of protein in the urine can be an early sign of kidney disease. Symptoms of kidney disease may include swelling due to fluid retention, tiredness, insomnia, itchy skin, and nausea. Kidney disease progresses through different stages as the kidneys lose efficiency and waste materials build up in the body. It also increases the risk of hypoglycemia and type 2 diabetes complications, including cardiovascular disease. The last stage, kidney failure, usually requires treatment with dialysis or kidney transplantation. Many of the medications available to treat type 2 diabetes are predominantly removed from the body by the kidneys. Declining kidney function can affect that process. If the body can no longer filter medications out effectively, the risk of side effects may increase. It may also be necessary to adjust the dose of medication or change medications.